Of children in Yemen could be pushed to the brink of starvation due to huge shortfalls in humanitarian aid funding amid the COVID-19 pandemic, according to a new UNICEF report marking more than 5 years since conflict escalated in the country. Yemen, 5 years on, children, conflict, COVID-19, and COVID-19 warns that as Yemen's devastated health system and infrastructure struggle to cope with the coronavirus, the already dire situation for children is likely to deteriorate considerably. The report also showed that an additional 30,000 children could develop life-threatening severe acute malnutrition over the next 6 months, and the overall number of malnourished children under the age of 5 could increase to a total of 2.4 million, almost half of all under 5s in the country, and a rise of around 20%. An additional 6,600 children under the age of 5 could die from preventable causes by the end of the year, an increase of 28%. The health system is teetering closer to collapse after years of conflict. Only half of health facilities are operational, with huge shortages in medicine, equipment, and staff. Poor access to water and sanitation is stoking the spread of COVID-19. Around 9.58 million children do not have sufficient access to safe water, sanitation, or hygiene. And with schools closed, 7.8 million children are not able to access education. Widespread absence from class and a worsening economy could put children at greater risk of child labor, recruitment into armed groups, and child marriage. The United Nations has recorded 3,467 children, some as young as 10 years old, recruited and used by armed forces and groups over the last 5 years. The report also warned that unless $54.5 million is received for health and nutrition services by the end of August, 23,500 children with severe acute malnutrition will be at increased risk of dying. Up to 1 million children will not receive vital micronutrient supplements and vitamin A, and 500,000 pregnant and breastfeeding mothers will miss out on essential nutrition support, including counseling on infant and young child feeding and folic acid and iron supplements. 5 million children under the age of 5 years will not be immunized against killer diseases. 19 million people will lose access to health care, including 1 million pregnant and breastfeeding mothers and their children.